So we talked last time about last two times we talked about radioactivity and the different particles, alpha, beta, gamma. Then we talked about radiation measurement in units. And today we're going to talk about nuclear medicine and health. What are the risks associated with radioactivity? So you're going to be doing a lab today, so I think it's good to talk about that, right? So one of the things that I've always talked about is I'll take a radiation risk over any kind of chemical risk, and certainly over biological risks. So biological risks are the worst because infection, it grows, right? You get a little bit of a dose of arsenic, it's not going to multiply in your body. Okay. Now, arsenic, may be more immediately damaging to your, biochemical systems. But again, the toxin is the dose, and you can calculate the dose and how fast you can metabolize that dose or get it out of your body, eliminate it. We'll talk a little bit about that today. And then we'll talk about where does nuclear radiation fit into that whole idea of risk. And then we'll look at some of the positive uses of nuclear medicine. So first, let's talk about our sources of exposure. We live in a radioactive world, and so we are exposed to radioactivity all the time. Most of our doses are coming from cosmic radiation. And this is also more... There's job-related risks. So if you're a pilot or a flight attendant, you're up above the shielding of the atmosphere, not completely, but quite a bit. And so your radiation dose is quite a bit higher than this. This is just for the average person, living a regular life, okay? But still, that cosmic radiation, some of it makes it through the atmosphere and goes right through your body and can cause ionization reactions in your body. The radioactive elements in the Earth's crust will give us about 47 millirem per year. Bricks and mortar, because we take those substances and make bricks and mortar out of them, and then we live in those structures. In fact, the granite used in the Texas state capitol has got a little bit higher concentration of uranium in it, so the granite is a little more radioactive than background. And so they talk about that when you go on a Capitol tour, that the building's radioactive, but everything's radioactive. If you turn on our Geiger counter in the lab, you'll let it, and it'll beep or click, about 8 times a minute, and it's registering, 8 radioactive events per minute, and so that adds up. And then from air, mostly just a general background amount of radon can be added in there. But radon in certain areas can add up to 200 millirem per year. Then we have man-made activities like X-rays. If you get an X-ray diagnosis, again, we're talking about ionizing radiation. So radiotherapy would be, this is sort of averaged out over everybody. If you go get radiotherapy, of course, your dose is a lot higher. Nuclear power industry, because everything is so shielded and so little is released, it really doesn't add significant amounts to our background radiation. TV monitors. Now this is this old school TV. These are the cathode rays. Okay. Now that's not really giving off. It's ionizing radiation. There's nothing in there that's happening that's nuclear. It's the X-rays. So electron gun is spraying electrons at a phosphor screen. And some of those electrons can knock out a 1s electron, which then you have an outer electron drop into the 1s shell, and that's an X-ray that's released. And so you can spray something with electrons and kick out 1s electrons and then create X-rays that way. And that's how the scanning electron microscope works when you do X-ray energy dispersive analysis. So you can spray electrons at the substance and then look at the characteristic X-rays that come out, and you can tell what the atomic percentage is of that substance. Now, it doesn't get everything because there's so little difference in the first 2 rows of the periodic table in terms of the number of protons and the energy of those X-rays, that they typically focus on everything from the 3rd row down. So they can do sodium on down. And we have a nice new X-ray fluorescence spectrometer and TRIs. And so that's our latest piece of equipment. But I remember Mom and Dad, they're like, "You're too close to the TV." I was trying to get the big screen effect and sit right there. And they were like, "It's radioactive." Now, they were always afraid of the microwave, too. And the microwave doesn't generate anything that's ionizing. Okay. So, yeah, you could have some leaking microwaves out, and that would just cause you to heat up the water molecules in your skin. But it's not anything that's going to cause ionizing radiation. It's not going to create cancerous reactions or anything like that. In fact, they make some non-lethal crowd dispersal weapons or tools, if you want to call them, that shoot microwaves at crowds. And it makes the surface of your skin feel incredibly hot, and you're going to run. This has been around a long time. It was a Popular Science article. The guy said that he was at this non-lethal weapons, technology center or whatever, and they had him out in a distance away from this vehicle, and they said, okay, stand in the sort of in the eye of the tent. He was out there in the tent, and they hit him with those microwaves, and he said it just felt like his shirt caught on fire, and he started screaming and patting at his shirt and everything, and he jumped out of the way, and it was immediately cool again. So anyway, it's kind of interesting, but the microwaves are not ionizing, so that's not going to cause any kind of chemical damage.
Do you know anything about the Havana syndrome?
No, that is totally strange. Yeah, have y'all heard of that? About there was this our U.S. delegates down in Havana were getting hit with some kind of beam of something, and it was causing brain damage. Yeah, they would have like hearing loss or ringing. What was it?
It was ringing in their ears, hearing loss, nausea, vomiting, brain damage.
Yeah, it was crazy.
All kinds of stuff, but all symptoms of radiation exposure.
Yeah.
And they haven't, I've been trying to read.
Yeah, it's really strange. So I don't know where that fits on all of this because we don't know what they're using. Yeah.
And if somebody knows, they're not talking about it.
That's right. Yeah. And so talking about ionizing radiation, we have different types. And so today in the lab, we're going to be dealing with all three. The alpha particle will be the smoke detector, but you'll verify that. That's like one of the questions in the lab. And it's stopped by paper, skin, air. So even though alpha particles are very damaging if they get inside the body, outside the body, they're not that bad. Beta particles will go through the dead skin layer and irradiate the tissues underneath the skin. And then gamma rays, depending on the energy of the gamma ray, but most of them will go right through the body. The largest, as far as I can tell, the atom with the largest cross section for gamma rays, meaning it has the highest probability of being absorbed, is iron. And we have a lot of iron in our body. So gamma rays can do damage, but we need quite a big dose before they'll do damage. They have little pagers that they wear in large metropolitan police departments, in case, places that might be at risk of a dirty bomb, that are gamma detectors. And so it's a little radiation pager, which you never want to go off, right? Because it's a pretty high dose situation if that thing goes off. But they talked about if you're walking down in the subway and that thing goes dee dee dee, he's like, back up and call in the response team. Yeah. So rapidly dividing cells, we talked about this a little bit before, that are the most affected by radiation damage and the most susceptible to being knocked into a cancerous mode. So things like bone marrow, lymph nodes, cancer cells. And so that's how we can kill cancer cells with radiation, because they're rapidly dividing. And so this is what we mean by ionizing radiation. So this first ionization energy of water is that barrier. And so we are essentially a body of water held together with skin and bones. And so what happens then is that water is ionized and typically makes a hydroxyl radical, and then it mediates other reactions in the body. So let's look at the biological effects. So this is our short-term radiation doses. So below 25 rem, there's no detectable clinical effects. And so we try to operate as low as reasonably achievable in various nuclear plants and operators. And so that's my past job at Pantex, we were able to stay below 0.1 rem per year, 100 millirem per year. This was the number I got from the Fukushima power plant whenever they had that problem. I guess it's been 11 years now. It's been a while. Yeah. And that, everybody wears dosimeters. Dosimeters are after the fact, and so you have to get them read. Ours was read on a monthly basis, and we got reports on a quarterly basis. And so you just kept your dosimeter on a board. You had whatever number you were, it was hung up there, and you take it down. If you were going to a radiological area, you put it on your collar or on your lanyard, and wherever you went, it was recording your dose. Now, it didn't record what your hands were doing. It got sort of the whole body dose. And so some workers who are actually working with radioactive materials would have like a ring they would wear, a little paper ring that had a piece of film in it. And so as they're working with the object, it's measuring a more accurate dose for their hands. Okay. You'll see radiation techs, like at the hospital, they'll have dosimeter badges. And so. Now, above 25 millirem or 25 rem, you start to see some sort of response in the body, a decrease in white blood cell counts. You get to 100 rem, and you're starting to see nausea. You might see a fever, and then this LD50 is 500 rem, so that's a pretty big dose. And we'll see how we'll look at the pharmacology of that in a minute. This is, I mentioned Fukushima. This was the boiling water reactor. We'll talk about nuclear power next time, but this is the nuclear fuel is in here. There's a reactor vessel. It's flashing to steam, and so then that steam piping takes it down here into somewhere in here is a loop that takes the heat out to spin a turbine that generates electricity. And so then that loop is closed. So the water that goes and spins the turbine is separate from the water that takes the heat away from the core. So we have two different water loops, and sometimes three. Sometimes the water that comes out of the steam then is cooled down and recirculated. So they try to protect the environment by having these containments of these different parts of water. Water is the most common heat exchange medium. It's a working fluid. So they take the heat from the nuclear reaction and then they make steam with it. And so you need a fluid to carry that heat. They do have really efficient nuclear reactor designs that use liquid sodium. Okay, so water's not the only thing that they can use. That just terrifies me, though, because sodium reacts with oxygen in the air. It reacts with water. If it hits water, it generates hydrogen from the water, and then hydrogen is an explosive gas. And so you just got, to me, I mean, I'm a little scared of the liquid sodium reactors. But anyway, this uses a boiling water reactor. They also have pressurized water reactors, and we'll talk about those next time. But the thing that happened at Fukushima was there was an earthquake offshore, and then it created an enormous tsunami. And the reactor was fine. When it felt the earthquake, it started shutting down. Like the control rods dropped in, and we'll see what that means in a minute, and it started to cool down. But it takes a long time to cool these things down. Okay? The real problem was this spot right here, this spent fuel pool. So whenever they exchange the fuel, this little gantry crane comes along, they open this lid, that comes down, it will take out a fuel packet and put it in this pool over here for all of the really short half-life nuclides to decay away. So after a few months, then it's manageable to take that off-site and go to a reprocessing facility. But for the first few months, it's incredibly hot fuel. And so they have this pool up here where they let it cool down a little bit. And that water is recirculated to keep it cool. And out here is a generator, like a diesel generator. And they had it up on a platform because Japan is an island nation and they know about tsunamis. And I forget the exact, but it was like the platform was 25 meters. And I thought, what kind of wave is going to be 25 meters high? And this wave was bigger than 25 meters high. Yeah. That's a big wave. So it shorted out the generator, which broke it. And so then this pool right here was no longer circulating. So this is the source of the explosion at that plant. It wasn't the nuclear reactor, it was the spent fuel. So that water in one building had a crack in it. So then the water was leaking out through the crack. And they were spraying, it had fire hoses, they were spraying water back in there to try to keep it full, but it wasn't enough to fill it up. So then the water level fell down below the top of this metal, and it started really heating up on top above the water, and it started catalyzing thermolysis of water. So the reverse reaction of H2 and O2 to make water, it was going in reverse because it was so hot. Okay. Now, if you're generating hydrogen and oxygen from water, it's a perfect stoichiometric amount to make water again. So this whole area up here had 2 moles of hydrogen for every 1 mole of oxygen. Perfect stoichiometric amount. And then, boom, it explodes. Okay, and it takes this square top of the building straight up. It's really quite an impressive video. You see this building and you see, boom, and the square lid just goes straight up in the air. Yeah. Now, it's pretty radioactive because of that pool, you know, and so then they found the debris elsewhere. And so this is sort of an analysis of what happened at that exploding nuclear power plant, right? You hear exploding nuclear power plant and you think, oh my gosh, this is Chernobyl, you know, this is Hiroshima, you know, we've got radioactive debris and dead people everywhere. No, nobody died from this event, okay, from the radioactivity. I mean, from the tsunami, who knows, you know. One female worker reached the limit of 0.5 rem, which they have that limit at 3 months. No, she got 1.7 rem, yeah, so 1,700 millirem. So she was, you know, that was not quite above a yearly amount, okay, but it was definitely above the 3-month amount. They wanted a whole, and I can't remember what the level is for men, but the female workers have a lower limit because there might be an unknown pregnancy, and so they try to operate them at a lower limit. And they did a medical diagnosis, and they said that there's no impact on her health. There were 201 people working there. The next door plant that also had problems had 645 people, and nobody went above this threshold amount. And that is, I mean, that is not what you were hearing in the news during all of this. They were like, oh, all these workers are going to die. They've all received a larger dose than everything. And it was just all made up. And I just really cannot tell you how low my opinion is of the media. It's not measurable. It's so low. They lie about everything. And now I sound like I'm going to get my tinfoil hat on, right? But I mean, you know, they talked about roaming gangs in Katrina, you know, during the hurricane. None of that was true. And what happens? A few months later, we have Hurricane Rita coming towards Houston, and a panic. We had millions of people evacuating that had no need to evacuate. We had at least 8 deaths on I-45 here in Huntsville from carbon monoxide poisoning. 8 people died in Huntsville because the media lied about what happened in the Superdome. Anyway, that's not rant over. But they talked about how all these workers are going to die. No one died. They did finally attribute one person's death to this event because of him working there after the fact, and he got lung cancer. And so this one lung cancer, they said, yeah, that was probably attributable to this event, but it was the cleanup. And so then after this hysterical response, Germany decided to phase out all of its nuclear power activities over this, that where there was, you know, no deaths associated with this accident. Here's deaths per 1,000 terawatt hours, which is 3.6 exajoules of electricity generation. And so if we were to generate all the whole world's consumption of power with these, how many deaths per year would we have? Well, for nuclear, if we were to generate turn the whole world over to nuclear, we'd have about 10,600 deaths per year. This is all of the deaths, including, you know, Chernobyl and 3 Mile Island and everything, all of our nuclear power for, you know, adding all of that up and averaging for this amount of electricity generation. For coal, if we did the whole world on coal, we'd have 11.8 million deaths. And I just did the math for all of these, you know. Even wind, 17,700 deaths. I guess, I don't know, people climbing up on the pole to turn the screws or something and maintain them. So after Fukushima, of course, there was debris everywhere. Some of the rubble did give some really high doses. Here's some piping and everything that got blown out when that building blew up. And so they used remotely operated forklifts. Like, there's no driver in that chair. So they set up the remote control, and they grabbed all that stuff and put it over there. And they've also measured the radiation as they're doing that. And it was 30 rem per hour. So remember that the LD50, so the expected death of half of the exposed population, is 500. So 10 hours of work with that pipe would get you to 300. You would definitely be sick. You'd be throwing up, If you worked another couple of hours, then 13 hours, you'd be at the LD50. So that's, and if you don't know it, like, you're over there shoveling all this pipe and junk and everything, and 2 days later you're dead. I think, that's pretty dramatic, right? Because you don't necessarily feel it. You're getting sunburn on the inside and you don't feel it, but you start to feel nauseous, and you're like, something's not right. Yeah. But that's why you wear the dosimeters. That's where you wear the radiation, detectors and so on. You can walk up to this little patch of radioactive material and you could detect that it is radioactive from a decent distance away. And so you would be able to stop that. Now, the edges of the site were 0.06 rem per hour, so pretty low, 60 millirem per hour. Some of the transfer pipes were pretty hot, 16 rem per hour. And then levels of air nearby were 2 rem per hour. So that's pretty high. So you wouldn't want to be, out there breathing without some sort of charcoal filter and particle filtration. Again, what you're breathing in are the particles. Now, unless it's a noble gas like radon, you're going to be able to trap it with a charcoal filter. All right, so let's talk about radiation doses. And let me check my time so I'll go over, because I end up talking a lot. So this is a tale of two theories, kind of a play on Dickens. There's the one on the left here, the threshold theory. So you can write down that threshold theory for toxicity, is that doses below the threshold can be handled by the body. Okay, so like there's arsenic in our drinking water, but it's a very low dose. Let's say it wrecks an enzyme here or there. It doesn't cause a catastrophic cascade of problems for our body. We can handle it, okay? Doses are not additive. We'll understand in a minute what that means, right? I get a dose, I metabolize it, I eliminate it or whatever, and then I get another dose, that's fine. They don't add up over time, okay? And then there's this separate theory with radiation that talks about hormesis, which is I don't know that it's controversial, but even people who are for radioactive, working with nuclear material, would disagree on this, for or against. But the idea is that small doses of radiation help cull out weak cells. Okay, so that's just I'll put that on this theory. Let's look at the linear no threshold theory. So all doses are detrimental no matter how small. So that's not how we deal with any other kind of toxin, but they've sort of applied this to radioactivity. And they said all radioactive doses are detrimental no matter how small. That doses are additive. That's controversial. We'll see why in a second. And this played a political role in 1959 to enact the Atmospheric Test Ban Treaty. So they've started really beating this drum that radiation was some sort of special category of danger, and that it was additive, and that if we didn't quit testing in the atmosphere, we're going to kill off everybody on the planet, because we're hitting them with this unique threat that nobody's ever dealt with. Okay. And then it's continued to this day, right? Because people just have this fear of radioactivity. But let's look at the additive dose thing. Have you ever breathed in automobile exhaust? Right? So you've gotten a small dose. And if this was a linear no threshold situation, that small dose would be detrimental and it would be additive. So the next time you breathe in automobile exhaust, you're going to get a little bit closer to the LD50. And then you breathe it in the next day, and maybe, another month or so on. And one day you're going to just flop over from carbon monoxide poisoning. But you know that, that carbon monoxide may get in there and bind to oxygen or bind to iron and the hemoglobin and hamper that particular blood cell's ability to carry oxygen. But that blood cell doesn't last. It dies, we metabolize it, and we refresh. And so that's what we mean by doses are additive. That's not additive. We metabolize those cells. We take them apart. We make new red blood cells. Now, if you get a high enough dose that it destroys your bone marrow and you don't ever produce red blood cells, okay, but that's an acute dose. And this is talking about small doses, that even the smallest dose adds up to a big dose effect. Or, breathing wrong, you get a little water in your lungs. Someday you're going to drown if you do that too many times. No, that's not how it works. You get the water out of your lungs. So this idea that the toxin is the dose, we're talking about acute doses. Now, there may be issues associated with chronic exposure to radiation, but it's not an additive effect. Okay, it's a statistical effect. Because once again, if you were to create a cancer cell and that cancer cell is not detected and killed, then it can multiply. And if you want to know how fast something in the body can multiply and grow when the body's not fighting it, think of a baby, right? From 1 cell to 8 pounds sometimes in 9 months. That's how fast something can grow in the body that's not being fought. So if you get a cancer cell, and again, statistics, so chronic exposure to radiation at a higher level than background, or even in background, a lot of our cancers are probably caused by radioactivity, but it's a statistics game. So more doses, more small doses, you're upping those statistics for cancerous cells. Okay. So there's ADME, absorption, distribution, metabolism, and elimination. So this is sort of the typical toxicology. You take in toxins, you can absorb them in different ways. You can ingest them, you can get them through the skin, through the moisture in your eyes, through, walking bare feet in the sand or whatever. And then there's the normal environmental inputs. And then if you do ingest it, your exposure time is governed by your metabolism and your elimination rates. And so if it's a chemical insult, then you metabolize it, right? And you mostly either your liver or your kidneys gets rid of it. Many times the liver changes it to a manner that your kidneys then can filter out. And so most of the time you're peeing it out. If it doesn't get distributed, it may just stay in your GI tract and you poop it out. But anyway, it's in your body for that amount of time. And so one of the treatments, if you do get exposed to a radioactive gas like tritium or radon, then you want to flush your body as fast as possible. If you get a radioactive element like a metal, you want to flush that out as fast as possible. So they'll do fast chelation therapy. They try to chelate that metal and flush it through your body, through your kidneys. It's really, it can be really stressful, I guess, for your kidneys, but you don't want those radioactive nuclides to stay in the body, because time, distance, and shielding are your 3 ways to mitigate radiation exposure. And if it gets in your body, you no longer have distance and you no longer have shielding. So time, you've got to get it out. So they always joked about tritium exposure. The solution is beer. Flood your body with multiple carbohydrates and lots of protons, and then it's a diuretic. It makes you pee. Okay. And it's a anxiety reducer. It's like you just have tritium exposure, right? So we need to keep you calm and we need to make you pee. So drink a lot of beer. So we always talk, if we were going to happy hours, like, oh, I think I've been exposed today. I need to go. I need to go have some therapy. And so we want to move those radionuclides through the body, get them out as fast as possible. But the best situation is distance and shielding. Don't ever get them in your body to begin with. Yeah. And then elimination, we talked about that, kidneys and liver. So this normal toxicological treatment, this is sort of that threshold idea. I was saying that below this threshold, there's no effect. Normal biological variation. There might be some people that are really sensitive and can handle a decent, or insensitive and can handle a decent dose. Other people, they don't have much sensitivity at all. So there'll be some statistical variation. This is that LD50, 100% lethal dose would be up here somewhere. But again, there may be some people that die at, say, 60% of the guaranteed lethal dose, okay? And so that's what they call the Frank effect level, expected death. I don't know where they put that. Maybe they put it at 90% of the lethal dose or what have you. But most of the time we list this LD50. So that's 50% of the population dies. Now they do this with as few numbers of persons as possible. A lot of times it's after the fact. They look to see what their doses were and they get statistics and they say, okay, this is where that curve jumps up. And so they calculate the LD50. They don't actually go out and give 100 people various doses of radioaction and see who dies. Or at least we don't do that. Maybe Mengele did that or somebody, some evil scientist. But most of this is, historical exposures, what happened. We, of course, learned a lot after World War II and the bombing of Japan. The United Nations came in and had this huge medical program to study different people's cancers and deaths and so on. And there's tons of reports you can read that analyze all of that data. It's pretty amazing. There's all these toxic substances that you could have in your body, and they have biological half-lives. Okay, so you can actually measure these things if you're exposed to them. But radiation is not a substance, and so there's really no biological half-life for radiation. Radiation is more like an injury. So when we think about the toxicity of radiation, I think that's the mindset to have. It's not a substance, it's an injury. It's like a sunburn. So if you get a sunburn, it takes time to recover. The worse the sunburn, the longer it takes to recover. But what you're doing in that recovery is you're repairing the injured tissues. Now, again, toxins have things like hypersensitivity. You could be allergic to substances. Some of these things, they accumulate. Look at the biological half-life for cadmium. That's crazy, isn't it? You can detect that cadmium in the blood for 10 years past an exposure. It really gets locked into the body. Here's mercury, and we are afraid of mercury. Here's mercury in the blood. 1 week. This is between a week and a year. Up here, like benzene, we're terrified of benzene. It does cause cancer, but you will eliminate it, and its half-life is less than 10 hours. Okay, so 100 hours, 10 half-lives easily. The benzene's gone. Okay. But people that are not able to metabolize or kill damaged or cancerous cells, those are the folks that get cancer really early in life because they walk out, UV light hits them, creates a cancerous cell, and the body doesn't have the mechanism to fight it. They're the ones that are going to get cancer right away. If you're this old and haven't had a detectable cancer in your body, then you have the ability to detect and fight cancer because you've probably done it already. So what happens when the body's detecting cancer? One of the ways is our cells produce proteins and carbohydrates outside the membrane, right? And so our body's looking at those substances, the proteins and the carbohydrates outside the cell, and it's sort of making the native, non-native determination, and it will kill the non-native cells. And a lot of times when cancer cells are reproducing so quickly, they don't glycosylate or put a carbohydrate coating on those extra membrane proteins, and then our body can recognize those as other, and then it can kill those cells. It'll trigger the T cells and they'll come in and kill the cancer cells. So you've probably statistically killed many, many cancer cells in your lifetime, or you would already have like a runaway cancer. This is I went ahead and Googled some things on on radiation damage and treatments. And this is a paper that I've put up on Blackboard. So you'll see that up there. It's an interesting read. And it's talking about this idea of treating radiation as an injury to the body. And just like you can take drugs to help you repair tissue, like anabolic steroids and things like that, there are ways that they're exploring to help people with radiation sickness. And so they're still doing research in this area. They're looking at it from an aspect of the probability of a dirty bomb or a radiological event. It goes up with time, especially with more countries having nuclear weapons and maybe less secure countries having those nuclear weapons, that something's going to get out and something's going to happen. And so the medical establishment is looking ahead to try to figure out how we could treat people who have been exposed. We talked about radon gas already, where again, it can percolate through concrete and get up into people's basements. The problem is when it gets in the lungs, it decays to elements that get stuck, and then they continue to spit out alpha particles. So this is the half-life of radon. It's pretty hot, 3.82 days. It kind of breaks my brain, though, to think about that. So this radon decays in a rock down in the crust, and its half-life is 3.82 days. How does it ever make it through all that rock and into my basement and into my lungs and not be gone, right? It's just a statistics game. There are some radon atoms that go a lot longer than 3.82 days. This is just a statistical measurement of the half-life. So most of that radon doesn't make it out of the soil.
So is that literally just an average? And so you're talking about
it's just an average. Years. Yeah, it had to have taken years. Yeah, it had to have taken years for it to get through the rock, through the concrete in your basement. And then you happen to go down and change the clothes from the washer to the dryer and breathe it in, and bing, it decays in your lung. Talk about bad luck. But that means there's an enormous amount of uranium in the rock, because it's a statistics game. It might be 1 in a trillion atoms can last that long. But if you have moles and moles and moles, you've got 10 to the 23, atoms of uranium decaying into radon. It's just a numbers game. And there'll be a few atoms, 1 in a trillion or whatever, that make it that long. And then boom, you bad luck, you breathed it in. And so that's why we want to ventilate our basements. Let's look at the medical breakthroughs using radioisotopes to image things. This is an example of it looks like they're measuring his shoulder, but they're trying to do his thyroid. Right. So right here in the throat is your thyroid, and the thyroid is just, for some reason, it collects iodine, right? And that's why you have iodized salt for thyroid function. Again, I don't know much more than that. But if you put radioactive iodine in the body, it will preferentially collect in the thyroid, and that thyroid will light up. And so then you can come across it with a detector. So just like we have our photomultiplier tube detector in the lab with the phosphor, and we can detect radiation, if we put sort of lead, kind of like blinds on, these collimators, that only photons can go through those blinds straight up and hit that detector, then we can get an image. So this is like a diode array detector. And so then you can image that thyroid. This is the Positron emission tomography, and this is absolutely my favorite. So if we take this carbon and put it into sugar, and we know that if a cell is dividing frequently, it's using lots of energy, and energy in the form of sugar, and so then that cancerous cell is going to soak up all of this sugar and be using it. And then when it's got that carbon 11 that decays into boron 11, it makes a positron, which then adds to a negative electron and gives off 2 gamma rays. And those gamma rays go off simultaneously in opposite directions. And so notice how it hits this detector and this detector at the same time. So it knows that came from somewhere on this line right here. And then these 2 detectors light up. And they know it was on this line here. And there, after just 2 events, I know the source of the hot spot where all that sugar has collected. And so you can super high resolution. Now, remember, we live in a radioactive world. So the cosmic ray from the sun comes in, unrelated to this, and hits that detector and causes it to go, hey, I got a spot too. But nobody on this side of the patient shows the signal at that time. And so the computer says, false alarm. And so it's called a zero background technique. That is great. So you don't have any like environmental signals, or you can throw all of them away, because the only time when you get a simultaneous hit on two detectors can you say that was a real event, and then you just draw the lines. The computer can image that thing in 3 dimensions. And so here's a picture of the patient in one of those. Okay. And they got her hand in a lead box because that's where the source of this carbon 11 is going into her IV, and they've just put a box on there to keep the noise down from the positrons, because it's spitting out gamma rays too, which would be detected through the side of the instrument. Come on. Okay, so in terms of nuclear fuel, we'll talk about nuclear power generation next time, but in these fuel elements, you have a lot of new elements being created. So the uranium's breaking apart, making barium and krypton and all these different elements. And one of the ones that it makes is molybdenum 99. So moly 99 is the precursor for technetium 99. And technetium 99 is something they can put into your blood, and it's water soluble. It's going to stay in your bloodstream. It's fairly inert. You pee it out eventually, but it's going to go where your blood goes. And so then they can put you on a treadmill and make you run. And this is a nuclear stress test for your heart. They can image the coronary arteries and see which ones light up the best. Okay, and if you've got a blockage, then they don't light up. They'll see dark areas, and they'll say, oh, you got a 99% blockage on this artery. We got to do a bypass surgery. So a lot of times they'll do a heart test, radioactive heart test. And this guy came into my office. It was a weird coincidence. I was testing with my Geiger counter. I had uranium acetate in my office. I'm testing it, and uranium is not very radioactive, and it's just barely clicking. And Arden Colette comes into my door, and my meter goes off scale. And I turn it to him, and it's off scale. I said, Arden, you are radioactive. And he goes, oh, yeah, I had a stress test yesterday. And I said, can you come to class tomorrow? Right? So he shows up to class in my freshman class, and I said, which is more radioactive, just uranium or Arden Colette? And the students are like, duh, the uranium. And I just tested it, and then I pointed it at him, and it was like, off scale. And they're looking at him. Well, it was this stress test. And so it's got a very short half-life, 6-hour half-life. And so they have to get it out of the nuclear reactor and into the processor so they can get it to the hospital so that it can get it to be used for these stress tests. And they don't make it in a power reactor. They make it in a research reactor. So this is a research reactor at the University of Dayton. And down here is the nuclear core. You see the blue light. That's traditionally what you see when a nuclear event's going on. And you see all these tubes that go out in there. Some of those are control rods, so they can, cool it down or heat it up. Others are what we call rabbit trails, I guess. But it's like the bank. You put your money in the thing, and the air will push it over to the teller, and then they do the thing, and then they push it back. This same thing operates here. You have these tubes down in the reactor, and air can push things in and out, and you put them in these little Teflon capsules and run them down right into the fuel and irradiate the crap out of them. And you measure the flux and the dose and all that, and then you bring it out and you can study stuff. You can take targets, put it down there, and create radioactive nuclides, and so on. So this is how they make the medical isotopes, is with these kinds of reactors. And you see these guys are up here chilling. It's radioactive, but it's not off scale like a power plant would be. Now, how do we get that radioactive element into a useful form? We have to use a hot cell. And I just wanted to show you a picture of a hot cell. These are hot cells at Westinghouse, where inside here is the really extremely deadly radioactivity, and you have these external manipulators. You can unscrew lids, you can weigh things, you can machine things, you can weld things. You can do all of this stuff with incredibly radioactive materials inside one of these hot cells. and it's all robotic. So the material will come from the reactor in like a lead pig, and it'll come in here, and you open the lead pig, and you pull out the radioactive material, and you manipulate it with these manipulators. So this is all, it's all worked out. So it's pretty cool. And I went ahead and put this Westinghouse hot cell facility and labs. I put that PDF up on Blackboard too.
Are there just kind of, there was like that detectors all over the place? Because I can't imagine, like, if there was even a small leak or something like that.
Oh yeah, they're dealing with deadly levels of radiation inside those hot cells. That's why everything's remote. And look at the glass here. There's like leaded glass or uranium glass. If these elements created these gamma rays, they also absorb them. And so they have uranium and elements in these, like depleted uranium, not the really radioactive stuff, in this glass to absorb the gamma rays and protect you. Now, beta and alpha are totally stopped by all that stuff, but the gamma is what you're worried about in this situation. Okay, we're out of time.